Welcome, future FCPS doctors. Today we're diving into the lymphatic system of the whole body, a high-yield topic for your Part 1 exam. This chapter, General Anatomy, is a gold mine with 4 to 5 BCQs in every specialty. So, grab your notes and let's learn this by heart. We'll start with the head and neck, then move to the abdomen. Let's go. First up, the eyes. Here's a key fact. The eyes have no lymphatics. That's right, no lymphatic vessels. This makes the eye an immunologically privileged site. Expect a BCQ on this. Next, the ear. The external ear drains into the superficial parotid, mastoid, and superficial cervical lymph nodes. Think of infections like otitis externa. These nodes might swell up. Memorize this trio: parotid, mastoid, cervical. Moving to the scalp. This one's a bit tricky, so listen closely. The anterior scalp drains into the submandibular nodes. The posterior scalp, around the mastoid, goes to the occipital nodes, then to the superficial parotid nodes, above and behind the ear. The lateral scalp, including the eyelids, drains to the parotid nodes. The central scalp, especially with the lower lips, goes to the submental nodes. In the buccal region, think cheeks, along with the anterior face and nose, drains to the submandibular nodes. Got that? Let's repeat. Anterior scalp to submandibular, posterior to occipital, then parotid, lateral to parotid, central to submental, and buccal to submandibular. Now the face. The front of the scalp, nose, cheeks, upper lip, and most of the lower lip, except the tip of the tongue, drain to the submandibular nodes. But the middle part of the lower lip and the lower two incisors, they go to the submental nodes. Here's a bonus. The palatine tonsils drain to the jugulodigastric nodes, a classic BCQ from Golden 4 and 5. If you see tonsillitis, think jugulodigastric. Let's talk about the submandibular region again. The buccal area, anterior face, and nose all drain here. Submandibular nodes are key for facial infections and cancers, so don't forget them. Repeating for the jugulodigastric nodes, the palatine tonsils drain here. This is the tonsillar node, expected in a question about tonsillitis or tonsillar cancer. Next, the tongue. This is a favorite for BCQs. The tip of the tongue drains to the submental nodes. The anterior 2/3 go to the submandibular nodes, and the posterior 1/3, that drains to the deep cervical nodes. Think of tongue cancer. Anterior spread to submandibular, posterior to deep cervical. Memorize this pattern. For the trachea, it's simple: pretracheal, paratracheal, and deep cervical nodes. Tracheal infections or tumors might involve these nodes, so keep them in mind. Finally, the thyroid. The thyroid gland primarily drains to the deep cervical nodes. This is a high-yield point for thyroid cancer questions. Papillary carcinoma often spreads here. Now let's move to the abdomen. First, the esophagus. The upper third drains to the deep cervical nodes. The middle third goes to the superior and posterior mediastinal nodes. And the lower third, that drains to the celiac lymph nodes. Esophageal cancer questions often ask about this. Upper to deep cervical, middle to mediastinal, lower to celiac. For the stomach, the lymph vessels follow the arteries, left gastric, right gastric, gastroepiploic, and all these groups drain into the celiac lymph nodes. Gastric cancer spreads to the celiac nodes, so this is a must-know. The duodenum has a dual pattern. The upper part drains to the pancreaticoduodenal nodes, then to the gastroduodenal nodes, and finally to the celiac nodes. The lower part also goes to the pancreaticoduodenal nodes, but then to the superior mesenteric nodes. This reflects its embryology: foregut for the upper part, midgut for the lower. The jejunum and ileum are straightforward. They drain to the superior mesenteric lymph nodes. Think of small bowel cancers or infections like typhoid fever. These nodes might be involved. For the transverse colon, the proximal 2/3 drain to the superior mesenteric nodes, while the distal 1/3 goes to the inferior mesenteric nodes. This split reflects its midgut and hindgut origins, perfect for a BCQ. Lastly, the descending colon and sigmoid. Both drain to the inferior mesenteric lymph nodes. Sigmoid colon cancer often spreads here, so don't miss this. And that's it for the lymphatic system SK pearls. Let's recap the key tip. This topic is high yield, 4 to 5 MCQs in every exam. Memorize the drainage patterns. Think about clinical correlations like cancer spread or infections and practice with past papers. You got this. Keep studying and good luck on your FCPS Part 1.